Okay, very good afternoon to all the respected doctors. On behalf of Hetero Healthcare, we warmly welcome all the doctors to the today's webinar. The topic of today's webinar is minimum invasive procedure for the mandibular impacted third molar teeth. To shed light on this topic, we are privileged to have Dr. Vishwaraj Nikam sir with us today. Specifically, Dr. Vishwaraj Nikam is a renowned oral and maxillofacial surgeon and associate professor at Rangoonwala Dental College, Pune. He is the innovator of the revolutionary MIPMIT technique for impacted third molar surgery, which received copyright from the Government of India in 2019, and is now trademarked in his name. Dr. Vishwaraj Nikam is a distinguished educator and authorized lecturer of the Maharashtra State Dental Council. He has trained thousands of dentists across India and internationally as well, including in Malaysia, Dubai, Singapore, and Sri Lanka and Uzbekistan as well. He has been honored with several prestigious awards, including the FAMDent Heroic Dentistry Award 2022, and he has represented India as a speaker for oral and maxillofacial surgeons across Asian countries. We welcome Dr. Vishwaraj Nikam sir to the webinar, and now I hand over this session to him. Along with that, that I have one small request to all of you doctors, that if you have any questions or questions during the webinar, please type them in chat box. Dr. Nikam will happy to answer them at the end of the session. So we will take questions in the end of the session. Kindly take a note. Okay, Dr. Vishwaraj Nikam sir, you can continue onwards. Sir, kindly unmute your setup. Okay.
Audible?
Yes, sir, you are audible.
Yeah. Very good afternoon, all, my dear friends. I was busy 2 minutes back only because there was a send off my batch. Every month, three people used to come to my place for the learning of oral maxillofacial surgery, and it was the certificate distribution and send off. So sorry for that. It was the voice background was there, and that's why it was sort of disturbing like that. Nice. I welcome you all and the organizers for this beautiful session, because dentistry starts at oral surgery and ends at oral surgery. In our day-to-day practice, oral and maxillofacial surgery is very important. Please sir, share the screen. Every day we are dealing with the difficult tasks in dental practice, like syncope, then shock, hypersensitivity, TMJ dislocation, aspiration of any instrument or a tooth, bleeding management. And these are the very common hurdles in our practice. As a good clinician, one must know how to avoid all these things, and if it happens, how to manage. Friends, the demand of speechless or minimal invasive procedures increasing day by day in all paths of medical science. So why not in dentistry? So in 2019, I invented one technique that is a minimal invasive procedure for mandibular impacted third molar tooth, a study to prevent incision and soft tissue handling, which is a very informative and very revolutionary technique, because, friends, what is the main culprit behind the post-operative complications like trismus, swelling, pain after the surgical removal of mandibular impacted third molar tooth? What is the main culprit? The main culprit is a soft tissue handling. Remember this: if the soft tissue handling is minimum, The post-operative complications are minimum. So demand of the stitchless or minimal invasive procedures increasing day by day in all paths of medical sciences. So why not in dentistry? If anybody want to open the abdomen, abdominal surgery, for example, and if you are visiting to the surgeon, you must, everybody, the today's era is a minimal invasive procedure. Everybody used to ask how many sutures are there, is it stitchless, is it minimal invasive? So demand of the stitchless or minimal invasive procedures increasing day by day in all paths. So why not in dentistry? Since 70 80 years, why we are incising for each and every case, in case of impacted third molar tooth? And the incidences of impacted mandibular third molar increasing day by day as per the generation and the food habits, because in old 30 40 years back there were fibrous food was there, but nowadays we are taking juices, burger, pizza and all soft food habits. That's why the development of facial muscles and bones are hampered, and the issue of impacted mandibular third molar is increased. So I invented this technique, MIT Dr. VH Nikam's technique, which is now accepted worldwide, and this is one of the best procedure in our day-to-day practice. Right. We all know the management of impacted mandibular third molar is a very common procedure. Everybody knows, I don't want to discuss this. Incision, reflection of a flap, osteotomy, suturing, and suture removal post-operative follow-up is a very routine and normal protocol. But I try to minimize this with the help of MIP, that is minimal invasive procedure for mandibular impacted third molar tooth, for which I have been awarded in 2019 by Government of India with copyright. I have been felicitated by Dr. Christopher Hammerle, University of Zurich, Switzerland, for the invention and copyright of MIP. What is the initial protocol and what is the MIP? I already discussed the initial protocol: incision, osteotomy, removal of tooth, toto, or after sectioning, and then sutures. Now I am going to show you one important case, that is first case, impacted mandibular third molar in fourth quadrant, and that is clinically the tooth is visible only 3 to 4% in the oral cavity. Is it possible for such case that you have to go with the minimal invasive without incision? Is it audible to everybody? Good. See the first case I am introducing you. This is the clinical presentation of this case, and this is the X-ray. Is it possible? Minimal invasive? And is it possible? This is possible only because of MIP, this new revolutionary technique, and this is the tooth out, like a simple extraction. This, see the patient's satisfaction and healing after 7 days. This is a magical procedure. What is the thing behind this? We'll explain you. One, in our easy language, when tooth is impacted, our motto is to remove the resistances of a tooth. Because see, tooth removal or extraction is like a wrestling. Always there is no need of force, excessive force. There are some tricks in wrestlings. So like that saying, there are some tips and tricks in extraction. So, what is the main protocol and what we are doing in this? I'll show you once again this case. This is the clinical presentation. This is the preoperative X-ray. Tooth is out, like a minimal invasion, and even the post-operative complications are very, very minimized. The time required for such a procedure is hardly 5 to 7 minutes. In your initial days, take it like a 10-12 minutes. That's it. So this is the win-win situation for patient and doctor both. Both are happy. So what is the protocol in this? Our main motto is like we have to remove the resistances of it. The first resistance is adjacent tooth. So we have to cut the contact point without damaging the second molar with the help of straight bar, and after removal of contact point the first resistance is gone now, right? But there are so many resistances in the form of tissue, distally, buccally, in the form of bone, distally, buccally. And two things are very important during extractions, believe me, note it down. 2P, one is purchase point and second is the path of removal. Extraction is very easy if you know the purchase point and path of removal. If purchase point is there, it's okay. If not, you have to create it. And path of removal is also very important because every tooth is having its own path of removal. So you have to study all these things. First of all, in your mind. Extraction should be there in your mind first, and then you have to implement with your fingers and your talent. And you are a surgeon, you must have three qualities. Must have lion's heart, lady fingers, and eagle's eyes. An eagle's eyes should be on the tip of your fingers. See, friends, after removing the contact point, just separate the tissue with the help of Moon's probe and take a straight micrometer burr and just remove the collar, make the purchase point, and remove the tooth not distally, distobuccally. So what happens in that? What happens in that? Cornucopia. It's a physics. Physics is the physiology of nature, and extraction is very easy if you know the physics properly. Galaxy is a cornucopia, sunflower is a cornucopia. So this is a concept of distobuccal. So crown comes buccally, tooth rotates on its own axis, root goes lingually and downward, cornucopia happens, and this is a path of removal, very easy. This is the cornucopia. Every quarter turn it becomes wider, and any element, any uh, paper or something is going out and upwards. Another case of radiographic, this is the clinical presentation. This is the radiographic presentation, contact point and purchase point. Purchase point should be below the contact point. And see the tooth is out. Three rooted tooth. See the invasion, minimal invasion. Because see friends, tissue belongs to the patient. Bone belongs to the patient. Good surgeon duty is that he has to preserve the things that belongs to the patient. And I'm cutting the tooth that has to be extracted, and that is a waste product for the patient. This is another case, the clinical presentation. This is a preoperative radiograph. Tooth is out. like a simple extraction. No need to go for the sutures. It will heal with the help of secondary intention, because in case if you are removing the lower six first molar, are you giving sutures every time? No, because it heals by second. Its nature is great. Like that, if your invasion, if your soft tissue handling is less, so definitely it will go with the secondary intention only. This is another case. If the second molar is if the second molar is carious, then uh, no need to take care of the second molar, because definitely it will go for the root canal. So the tooth is out like this. Another case, another case, 4-8. Now, in case of distal angular, definitely if you cut the contact point, the resistance, surface resistance is now minimum, because we are applying the elevator distally, and the lowermost point will act as a fulcrum, and tooth will rotate around its own axis. And this is the one good idea to rotate the tooth and make it straight. And this is one of the revolution in case of this triangular also. See the rotation of a tooth, and three rooted this triangular tooth is out, and see the invasion. Another case, this is a one simple case, one horizontal tooth around 35% is visible clinically in the oral cavity. See the presentation radiographic. Tooth is out, and see the post-operative uh, invasion, like a simple extraction. See even the clear and healthy margins of a socket. Why there is a need of suture? No need, absolutely no. Another case, some difficult cases, this is a bulky case, bulky root, it is out like a simple extraction. Another case of one gynecologist, one of my friends, she's a dentist, and her husband is a gynecologist. She called me. This is a clinical presentation. Tooth is not clinically visible in the oral cavity, and this is the preoperative X-ray. Friends, see the procedure and time required for this. Procedure started. It's so deep, the C junction. That's why it's quite difficult. चला सर गॉड निघाला. See the conservative approach. No incision, nothing. Everything is covered. Yeah, with this. With this. And this is out. See, this is a very conservative approach. The time required for this is hardly 2 minutes. Without anything, just reflect it. That's it, out. Without any surgery, without any suture. This is the extracted tooth. See the invasion and healing after 7 days. And see the experience shared by this couple, by because I visited her clinic only. Just listen to this.
नमस्ते, मी डॉक्टर शिवराणी खानावरे, डेंटिस्ट व माझे मिस्टर डॉक्टर अमोल खानावरे, गायनेकॉलॉजिस्ट आहेत. आम्ही बिगमनला खानावरे हॉस्पिटल मॅटर्निटी व डेंटल येथे प्रॅक्टिस करतो. त्यांचा हॉरिझॉन्टल इम्पॅक्टेड टूथ होता. आम्हाला डॉक्टर दिलकाऊन विश्वराज सरांचे नाव व त्यांचे जगप्रसिद्ध लॉंग सर्जिकल टूथ एक्सट्रॅक्शन प्रॅक्टिस बद्दल समजल्यानंतर त्यांच्याकडूनच टूथ एक्सट्रॅक्शन करण्याचे ठरवले. त्याबद्दल त्यांच्याशी कॉन्टॅक्ट करून त्यांना व्हिजिटसाठी रिक्वेस्ट केली व त्यांनी लगेच होकार दिला व आमच्या हॉस्पिटलला आले. त्यांच्याबद्दल माझ्या मिस्टरांचा एक्सपिरियन्स ते शेअर करतात. नमस्कार. माझं 1 वर्षापासून ज्यावेळेस एक्सरे काढला त्यावेळेसपासून आम्हाला कळलं की माझा हॉरिझॉन्टल इन्फेक्टेड टूथ होता. पण ते काढायची भीती वाटत होती कारण ते सूज आणि माझ्या गायनेकॉलॉजिकल प्रॅक्टिसची रोज प्रॉब्लेम येणार होता म्हणून. पण ज्यावेळेस निकम सरांचं कळलं आम्हाला की निकम सर नॉन इन्व्हेसिव्ह पद्धतीने नॉन इन्व्हेसिव्ह टेक्निकने व न इन्सिजन घेता बोन लॉस न होता टूथ काढतात म्हटल्यावरती एक धीर आला. ज्यावेळेस सर आले त्यावेळेस आता सध्या सगळ्या सर्जिकल ब्रँच मध्ये नॉन इन्व्हेसिव्ह टेक्निक पुढे येते. त्याचप्रमाणे डेंटल सर्जरीमध्ये पण नॉन इन्व्हेसिव्ह पद्धत त्यांनी आणून ते जग प्रसिद्ध म्हणजे वर्ल्ड वाईड फेमस होत आहे. त्यानुसार त्यांनी आल्यानंतर मला काउन्सिलिंग करून व्यवस्थित लोकल लोकल अॅनेस्थेशिया दिल्यानंतर काही समजायच्या 3 ते 4 मिनिटांमध्ये न बॉन लॉस होता न सुचर घेता त्यांनी माझा दात काढला. त्याबद्दल मला नंतर एक अर्धा पाऊण तास झाल्यानंतर मी लगेचच माझे रुटीन ओपीडी पेशंटची काउन्सिलिंग करायला चालू झालं. आज सेकंड डे आहे टूथ एक्सट्रॅक्शन नंतरचा, तरी पण अजिबात स्वेलिंग नाही, काही नाही. त्याबद्दल आम्ही पूर्ण खानावरी कुटुंबातर्फे निकम सरांचे हार्दिक हार्दिक आभार मानतो व त्यांच्या जे पुढचं रिसर्च आहे ते असंच वर्ल्ड वाईड फेमस व्हावं त्याबद्दल त्यांना.
Another cases. See, this is one case. J hook and tooth is out. See the invasion. No need of stitches. Absolutely no. This is another case. See, start to end. It is not visible in the oral cavity, undermining the tissue. This is my favorite instrument. We call this as a Bhavani Talwar.
Yes. Just undermining without incision. Yes. See the tooth? I am creating the purchase point. See the tooth is coming out. Yes. Very good. Just dear cooperate with 5 minutes, please. This is without incision, with minimal invasion. See, the tooth is coming out. Tooth is out. See, in toto, and
See the invasion of this case. The tooth was not visible in the root cavity. Why we incise the tissue? Whenever you incise the tissue, there is a cut in the blood supply and full thickness periostal flap when you raise from the underlying tissue, there is a definitely a reflection from a body in the form of inflammation or swelling. So always avoid the soft tissue handling. This is another case. The tooth of third quadrant impacted, 8 not visible in the oral cavity, and the patient is having a chubby cheeks like this. Even the erupted third molar is also there, and whenever the patient is opening the mouth, that we have to search for the third molar because there is a fat over the occlusal table of 8, and in such cases the preoperative x-ray is in like this. Can you imagine this case with minimal invasion? I think definitely no. but it is possible with MIP, MIT, and tooth is out, like a simple extraction. Another case, one horizontal tooth with J hook very close to the nerve. The lowermost part of the tooth is digging in the distal part of the second molar, and see, the tooth is out like a simple extraction. And this is a patient satisfaction after surgery. One more case, quite difficult case of horizontal. This is a clinical appearance, and the X-ray is like this. Can you imagine this, like without incision and stitchless surgery? But this is possible with MIP, MIT, like this. And see the invasion. And this job is of only the procedure is need only 5 to 7 minutes. Post-operative radiograph. Another case. This is also one impacted tooth, toto, surrounded by the bone. Tooth is out, and this is the invasion of this tooth. This is a post-operative radiograph. See the minimum invasion of the bone also. So this is the satisfaction, any satisfaction. This is one case. The patient, there is a uh, cause in the patient's mouth, and patient is explaining the experience, and just listen to this.
It was awesome. It was best and fantastic. My words are less to say. It was good. I was nervous before, but then when he started working, it was very good. I felt nothing at all. Right from the beginning till the end, it was great.
Thank you very
And it
much.
was so. I'm not finished. It was so quick, and I don't believe that I've finally removed it without any suture or without any surgery. It is such a satisfaction. It was so conservative and great.
Thank you very much. Thanks a lot. Thanks a lot.
You're welcome.
Chalo, now suturing techniques. Go for. This is one more case. Quite difficult case. The tooth is very deeply seated even, and see the result of MIP, MIT, like a simple extraction. Post-operative radiograph. These are my instruments. First instrument we called as a Bhavani Talwar, and second instrument we called as a Bhala. The real name of the first instrument is a London hospital pattern. London hospital pattern. There are serrations on the blade, and second instrument is Cogswell. Old is gold always. These are the real and good old instruments. That's why it's called as a London hospital pattern. We conduct courses worldwide and even in my clinic. So these are some pictures of that. Another case, impacted forehead. See the bulgy roots, huge roots, and see the magic of MIP, MIT. Post-operative minimal invasion. I conduct courses till now. These are the cases performed by me. But now I conduct courses for BDS and MDS, both doctors from India and out of India also. 2 days courses in every city of India and out of India. And if you want to learn the real practical hands-on and everything, 1 month course is also there. Three people, three doctors batch is there. So these are the some experiences not done by me. This case is performed by this girl from DY Patil, Mumbai, who came long the way from 1 month course at my place at Pune, near to Pune. I conduct courses in Fulton. This is the case, and see. This is a tooth which is impacted, and we are going to remove. This is not visible in the oral cavity, absolutely not visible. Now, after I have injected already the local anesthesia, now the procedure is started. See, this is MIT Dr. BH Nigam's technique, in which I am just retracting this flap so that if possible, the tooth tip should be visible here. Yes. Now, as per my technique, starting here to break the contact point without hampering it. I will reduce the contact point by trimming the egg, and now with the proper irrigation, we have to take this. We have to trim the border. Irrigation should be there properly. Suction should be started. Yes. I'm just cutting the bone. Just cutting the bone. Don't go lingually. There is a lingual nerve, and the lingual nerves are especially very dangerous. Irrigation please properly. Acha. Okay, thank you. It's okay. Now, it's okay. Now I'm trying to elevate this tooth. I have received for the purchase point first of all. I think I am not getting purchase point still. And let us see if I am getting purchase point is okay. If not, I have to create it. Okay. I am not getting the purchase point. So I'm taking the purchase point. I am making a page to make the purchase point here. Hello. No. Irrigation, please. Okay, light. Irrigation. Suction. Now again, I'm trying to elevate this tooth. It's a very tough bone over there, I think. Fracture. Yes, the crown is broken over there slightly. It's okay. Still, I'm not going to open. No incision. No incision still. And see the bloodless field. This is very important during surgery. Okay.
I'm making the purchase one. Again, for this broken root, start. Why to incise the tooth? This also. Minimal invasive procedure this is. Still the crown is broken. I'm not incising, I'm trying my level best. And see, magically, come here. Don't go there. Come here. See, magically, this tooth is coming out. Is out. See, do that please. MIP, MIT Dr. VHV technique.
The
The
tooth
tooth is
was
the crown
broken.
is broken
Still,
because there was a carious crown.
I
And
didn't
see,
take the incision.
after that also,
See the
I'm not
minimal
incised the
invasion
tissue.
and blood
This
less
is the
filled.
minimal invasion of this procedure.
And see the experience of
नाउ
one
अभी
of the
10 साल
patient.
हो गए हैं मैं स्पेशली डॉक्टर निकम सर के पास पुणे से आई हूँ ऑल द वे ट्रैवल करके मैंने दूसरे डॉक्टर के पास जाके कंसल्ट किया था बट उन्होंने मुझे स्टिचेस लगाने पड़ेंगे एंड 1 डेढ़ घंटे का ऑपरेशन बोला था बट मेरे हस्बैंड का टूथ अक्कल दैट इन्होंने ही निकाला था दैट इज विदाउट एनी स्टिचेस विद इन 3 to 4 मिनट्स डॉक्टर निकम ने मेरा अक्कल दैट निकाला उसके ऊपर पूरा स्किन था वो तो अक्कल दैट दिख भी नहीं रहा था उन्होंने एकदम पेनलेस और सर्जरी किया है आगे से एंड एकदम मतलब मुझे कोई पेन नहीं हुआ है कुछ भी नहीं हुआ है और पूरी दुनिया में ये एक में डॉक्टर ऐसे हैं जो अक्कल दाढ़ प्रॉपरली निकाल के देते हैं दैट टू विदाउट एनी स्टिचेस यू कैन सी पहले ऐसे थे वरना और अभी विदाउट एनी पेन उन्होंने निकाल के दिया है अभी ये मेरा ये साइड का निकालना है मैं सेकेंड टाइम फिर से आऊंगी ये साइड में निकालने के लिए एंड आई वुड रिकमेंड कि आप कोई भी डॉक्टर जाने से पहले इनके यहाँ प्लीज आना बिकॉज ये आई वुड से फॉर मी इज द वर्ल्ड्स बेस्ट डॉक्टर बेस्ट
I conduct different type of courses, and these are some photographs of courses, and some cases I want to share so that your confidence will go high, so that any impacted tooth from today onwards, will try to minimize the invasion like this. This is one of the case done by the student. This is another case which performed by the student from, I think she came along the way from Bede to learn the MIP MIT 1 month course. This is another case. See the tough bone and the horizontal tooth. The tooth is embedded in a bone totally, very close to the nerve in your language. But I think nerve issue is not there until and unless you go and directly hit the nerve, because nerve is an hollow space. If your tooth is moving, the nerve is moving, no need to take a thing more for that. This is a very small physics girl, very but still she removed this inverted tooth very nicely. I told you, no need of force, there are some tricks like a wrestling. See the another case. You must think for this. Such a cases are there. See the root pattern, the curvature. See the bilateral hooks. Both hooks are roots. Hooks are there, and see the patient satisfaction on the face. These are the girls came long the way from Bhuvaneshwar, Odisha, for the 1 month course. Another case. See the lower X-ray of third molar. The very near to the root of distal root of second molar. Quite difficult case, but very nicely performed. This girl came long the way from Dubai to my place for 1 month course. Now she is practicing in Debrecen, and she's exploring this MIT worldwide. Another case, see the invasion in this case. Just think, you have to think twice where to give the sutures. So these are the tips and tricks in the oral and maxillofacial surgery. You minimize the treatment and make the patient happy, give the result. Because if you are incising the tissue, it belongs to the patient. If you are cutting more bone, then 1.5 hour procedure, and even the post-operative complications in the form of trismus and swelling more. So to minimize all these things, to minimize the time post-operative complications, this is a very good procedure, good part of oral surgery. See the another case, you'll surprise the magic of cornucopia. See the root patterns, and very, very nicely done this case without breakage of root and just the following of the physics rule of cornucopia, and the tooth is out. This is not easy case. Sometime you can you'll think like, is it an animation or what? But no, I'll show you the live cases. Another case, tooth is embedded in a bone and tooth is out. Next case, and the patient satisfaction is more important. See the invasion, like a very small slit invasion. Healing is very nice after 7 days, definitely, because there is no tissue handling, nothing is there. See the bloodless fill, no bleeding, nothing. It's a very beautiful procedure, MIPM. And now this is accepted worldwide. Uh, I started uh, spreading this technique worldwide. Most of the India is covered. Only the Meghalaya and that area is left. Otherwise, from Kanyakumari to uh, Kashmir, even I was speaker in Kashmir, IDA Kashmir, Srinagar. The girl from the Indore came along the way for this course. See one another case of impacted mandibular third molar with cystic lesion. There's a possibility of mandibular fractures, and we have to go with the after the fracture of mandible. Definitely, the recon plate is must. But I tried my level best with and see the healing in the last third photograph. The good healing is there. This is the procedure one to one we used to teach with every patient. Another case, see the girl is performing this. सगळं दाखवायचं ते पण दाखवायचं. Very good. Dr. Shruti, I'm very happy today. Independently, you have done case. Show the case like this. Case like this. Finger. Just show me. Show the invasion. It's like a simple extraction. See the invasion and bloodless fill. Very nicely done. Very nicely done by Dr. Shruti. And this was the case. You have done very nicely. And I'm very happy. This was the case. The done best, by this girl. The best. Another case. That's why I am trying to show you more cases so that your confidence will boost, and definitely you'll try to happy your patient by removing all this impacted third molar stitchless. See the another case. People from out of the India also used to come to my place in Pune's clinic to remove the impacted third molar stitchless. See the another case of one foreigner bilaterally.
Sir, sorry to interrupt. Sir, sir, we need to wind it up by 4 p.m., sir.
Yes,
Because, sir, we need to
exactly.
wind it up by
Yes,
4 p.m.
exactly.
Yes, yes. No problem, sir. Yeah,
Yes.
continue, sir.
Absolutely. Why not we invite you? So that minimal invasive. It's like a simple extraction. Very nice. Nicely operated by. So nice here. And your one work is over. Good, 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 good. You're happy? Thank you, thank you. And now tell your yes people, your friends, come to India for the speechless and fitness extra.
Last 2 3 minutes for, and then we'll discuss your questions. This first time I presented in Maharashtra State Conference, then IDA Karad, General Conference, National Conference, first time in Kerala. This is the response of this wherever I go as a speaker. Sometimes what happens, 8 is there, 7 is missing, and 6 is present. How do you do it? I got a national award for this at Tiruvananthapuram, Kerala. International launch of MIPMIT in Tashkent, Uzbekistan in 2019. First time in the Maharashtra State Conference of Oral and Maxillofacial Surgeons of India. AMSI, Association of Oral and Maxillofacial Surgeons of India. The National Conference of Oral and Maxillofacial Surgeons of India. Asian Congress, 42 countries, oral and maxillofacial surgeons were there. So this is worldwide accepted. Live demo in Ahmedabad Dental College, Raipur, 2 days course in Raipur, like this. Uh, this is my award at Colon Prevention, appreciated by Nicole Sharkar, FAMDENT 2020 Pune, FAMDENT Hero Dentist Award, Hotel Taj Award. And the most important thing is appreciated by Dr. Stanley Malamet, sir, for this invention. This is my copyright, not only copyright, this is will be in the textbook of oral maxillofacial surgery with the name of MIPMIT, Dr. B.H. Nikam's technique. These are my hobbies. I played a role of Chhatrapati Shivaji Maharaj apart from surgery. And you can uh, take this number, join my Instagram, Facebook, contact me. Feel free to contact me anytime. Even to my channel, YouTube channel, Dr. Vishwaraj Nikam. And this sentence is very important. The perpetual preservation of what remains is most important than the meticulous replacement of what is lost. Devon's principle. And this is very important in surgery as well as in life. Preservation is more important than the replacements. After surgery, I definitely thankful to this my friends of Hetero, and definitely after surgery we need some medications, and the post-operative care is very important. That is one of the important part, and I prefer mostly Exum mouthwash. It is very effective, including the hyaluronic acid, and this is nowadays this is in a very small form. And 10 ml is also you can wherever you are traveling. It's very convenient to you to take with you and even the burning sensations are less in this. And definitely you can, after 48 hours, yeah, 24 hours, you can go with the gargles with the patient, so that we are not giving the sutures, right? So the food lodgement should not be there. So warm, some good gargles should be there, so that will take care of post operative care is there. And definitely this is a very good results I noticed in my all this after the surgical procedures, intraoral whatever may be. And these are the indications for this mouthwash. This is really good. And even we are giving the post operative some medications, mpx cv 625, that is amoxicillin 500 plus clavulanic acid 125. Then I noticed that's the gastric irritation is less, and mostly the problem of the antibiotics is the diarrhea. So definitely the minimum such incidences I'm observed in this. So I really prefer this MPX-CV to my colleagues, and definitely I'm using in day-to-day practice with this. And definitely thanks for this good organization, and I'm always with this company. And thank you very much, PC sir and the team. Thank you. Hello. Hello.
So, hello. Thank you, Dr. Vishwa.